Hi everyone, welcome back. Thanks again for joining me. I hope lower extremity strengthening level 2 went well for you. Today we're going to go over some foam rolling of your hips and legs. This is a great exercise to do on a regular basis to keep your tissue mobility working well for you so that you don't have tightness and pain and pulling, especially if you are sitting a lot for work. This is a great exercise to be doing to keep you mobile. So if you have a foam roller, you're going to need it. If you don't, you can't really do these exercises without a foam roller. You can do them with a rolling pin with your hands. I'll talk about that later. But for this workout, you will need a foam roller. You don't need a long one like what I have. You can use a 12-inch length one would work too. Okay? So we're going to start on our side. For each of these different areas of the hip and leg that we're going to do, I will start with an anatomy picture and kind of walk through the muscles that we're going to be working on so that when you're rolling, you can sort of visualize them. Here's a picture of your lateral hip muscles and down the thigh. This is what you'll be starting with on the roller. You can see where it says iliac crest hip bone. You're going to start just below that, and you're going to work your way down. You're going to stop kind of midway where I talk about your greater trochanter. You don't want to roll over that because it's a hard bone and it doesn't feel good. You'll skip over the greater trochanter, which is about where that tensor fascia lata is pointing to. You'll go below that and work on the iliotibial tract, or the IT band. And we're also going to work on part of your lateral quad muscle, vastus lateralis, and a little bit of your lateral hamstring muscles, the short head and long head of the hamstring in the back. Okay, so we're going to start with some of those glute muscles. As you can see in the anatomy picture, they actually wrap kind of around the side of your pelvis. And so that's where we're going to start. If you feel on your hip, you can feel that bone there that's kind of hard. You don't want to roll on that. That's your hip bone, the outside of your hip bone called your greater trochanter. You saw that in the anatomy picture. You don't want to roll on that because it's just not going to feel good. So we're going to roll above it up to the top of your pelvis, which is kind of like that shelf. It's like the baby shelf where you put a baby when you're holding them. So we're going to roll up to that shelf and down to the greater trochanter. That's where we're going to start. Then we're going to move beyond the greater trochanter and do the outside of the thigh along the ever so famous IT band, which is a problem for a lot of people. Okay, so here we go. You're going to come down on your elbow, put the roller under that glute muscle that we looked at in the picture. I can feel the shelf up here, the top of my pelvis, and then I can feel my greater trochanter right there. So it's not a huge area. You can see I've taken my top leg, crossed it up and put it on the floor. That's going to support me as I do this. My bottom leg is just kind of hanging out here. And I'm just going to roll up and down. You might find some problem spots. You might come a little forward, roll a little back, and find something that maybe doesn't feel so good, and focus on that a little bit. As you do this, your roller will kind of move around. You might have to readjust. I'm going to readjust more just so that I can stay in the picture. Okay? So then we're going to move beyond that greater trochanter. Now I'm below it. And we're going to roll along your IT band. This is one that for a lot of people is not super comfortable, but it's good to do. The more you do it, the less it will hurt. You're going to start kind of at the front of the IT band, almost like you're in your quad muscle, and then work your way along the fibers as they go on the side of your thigh, and then sort of the back fibers, almost toward the back of your thigh. Okay, so that was the lateral glute muscles and the IT band. Now we're going to roll kind of to our back and do more of the big part of the glutes, hamstrings, and calf. So here's the back of your thigh from glute all the way down to calf. You can see the gluteus medius muscle up at the top right. That's the one that kind of wraps around to the side that we were working on your side also. The biggest one here is the gluteus maximus, which is that big guy that wraps all around. In the video I talk about your ischial tuberosity. That's essentially kind of at the bottom of that glute muscle where it's crossing into the tendinous fibers on the outside by the iliotibial tract. When you do your hamstrings, you're doing those muscles on the back of the thigh, bicep femoris, semitendinosus. Those are the hamstring muscles that you're doing. So you want to make sure you go to the left and to the right and the middle so you get all of them. You notice in the video I'll say don't go on the back of your knee. You can see why. That area in the back of the knee, there's not a ton of muscle and there's a lot of nerve and blood supply. They just don't really like to be rolled. So you'll skip the back of the knee, go just beyond it, and then work on your calf. You can see that gastrocnemius muscle. That's your gastroc. That's your big calf muscle. It spans the whole calf. So again, you have to do all the way to the left, the middle, and all the way to the right, which is what I show you in the video. Okay, so here we are doing the posterior part of the glutes. I've got the leg I'm going to work on out straight. I've got my other knee bent. I'm going to tip my body just a little bit. This is my right side, toward my right side. I'm not going to do this in the middle. That's going to get my tailbone. It's just not going to feel very good. And there's not a whole lot of muscle there either. And we're looking for muscle. So I'm going to tip a little bit to the right. I'm going to roll all the way down to what people in yoga call the sit bone. It's the ischial tuberosity. We talked about that in the anatomy pictures. I'm going to go all the way down to that and then roll all the way up to the top of my pelvis. That shelf, you can follow it around. So I'm going to go to the top of that shelf on the back side. That's the whole glute muscle, group of glute muscles. It's big. Your glute max is huge. So up and down. I'm going to find trouble spots, focus on them a little bit more to the outside. Find a trouble spot, focus on it a little bit. Okay, now I'm going to work into my hamstrings. So I'm going to go beyond that ischial tuberosity and come down my hamstrings. Now your hamstrings cover the whole back of your thigh. So again, you have to kind of roll to get all of them. I'm going to roll a little bit to the outside of my thigh. Try to get the outer hamstring, then get a little bit more in the middle, and then get more of the inside of my hamstring. Okay? Then I'm going to move the roller beyond my knee. I'm not going to do the back of my knee, but just beyond the back of my knee is my calf. And I'm going to roll my calf. If you have the mobility, bring this foot on the other side of the roller. But you got to be able to bend your knee enough. Otherwise, you can just do both legs at the same time. But that requires a bit of arm strength. If you don't have it, just see where you can put this leg so it's out of the way. Again, the calf, you got to do the outside, the middle, and the inside. Okay? All right, let's move to the front of the thigh. Lastly, here are your anterior thigh muscles, mostly made up of your quadricep muscles. But you can also see in this picture your adductors, adductor longus, magnus, gracilis. Those are the muscles on the inner thigh, and in this video I do show you rolling out those muscles in addition to the quadriceps. But we'll start with the quads. You're going to go up near where the tensor fascia lata, where you see that attaching, also the sartorius attaches there, that's the front of your pelvis. That's where you're going to start. And then you're going to roll down. You're going to roll down the vastus intermedius in the middle, but also don't forget to do the lateralis on the outside and the medialis on the inside, vastus medialis. So just make sure, like all the other pictures, that when you're rolling, you start on the outside and work your way in. You don't want to go all the way down to the patella, the kneecap. That won't feel so good. Just stop just before that. So here I am on the front of my thigh where my quad muscle is. Just like all the other muscles we've worked on, it spans the whole front and into the sides. So you can't just do the middle front. You got to do kind of the outside, kind of the inside. So I'm going to start a little bit on the outside and roll that quad all the way down just above the knee joint, all the way up to the hip. Then I'm going to roll a little bit into the middle of the thigh. I find it easiest to just kind of let the other leg lay there. I'm not necessarily rolling my other leg, but it's just kind of there. And then I'm going to turn and do the inner quad. All the way up to the hip, all the way down to the knee joint. You can even try to get the adductors, the inner thigh muscles, by putting your leg in a little bit of a frog position. Sometimes that one's easier to do with your other leg off the roller, like that. So these rolling exercises do require a bit of arm strength. You definitely have to have some upper body strength to be able to hold yourself up and roll and move yourself around. If it's too difficult for you, you can use a rolling pin, and I'm going to show you that next. So I've got my rolling pin. I'm going to start on the outside and roll. Hello, Ruby. Go lay down. Anytime you get on the floor, those dogs just want to work out with you. So it's like the foam roller, but certainly easier on the body. You can also do this seated in a chair. You don't have to sit on the floor like I am. And you're just going to work your way around. And you can do your calf. This is an actual rolling pin. You can also do this with a fascial stick that's actually meant for this purpose. But a rolling pin works just as well. When we're talking about rolling with a foam roller or with a rolling pin, you want to focus on each area for a minute to 2 or more. But if you're doing your whole glute, thigh, everything, your arms are going to get tired. So in all, I would probably focus on it for 5 minutes, 8 minutes, depending on what you can tolerate. If you've never done this before, it's going to be uncomfortable when you start. You're going to have knots and areas that are really tender. But the more you do it, the tissue mobility will improve and it will not be tender anymore. I promise, it will happen. All right, that's the end of our foam rolling video. If you have any questions, please email us and join us next time. We're going to work on some neural mobility, improving mobility of your nervous system. Thanks a lot. See you next time.